If you're over 60 and taking more than one medication, there is a very real possibility that two of those prescriptions are quietly working against each other inside your body right now. Not years from now. Right now. And your doctor may not have warned you because most physicians only track the side effects of individual drugs, not what happens when they collide. I'm Dr. Elizabeth Aliu, and today I'm going to tell you about 5 common medication combinations that carry serious hidden risks for seniors. By the end of this video, you're going to know exactly what to ask your doctor at your next visit. The number 1 combination on this list is something that millions of seniors take every single day, and most have absolutely no idea what it's doing to their memory. Let me put this in perspective. The average senior over 65 takes between 5 and 9 prescription medications every single day. 5 to 9. And every time you add a new drug to that list, the number of possible interactions doesn't just increase, it multiplies. 2 drugs have 1 possible interaction. 5 drugs have 10. 9 drugs have 36 possible combinations, and every single one of those combinations is a chance for something to go wrong inside your body. Now, your doctor prescribes each medication for a reason. I am not telling you to stop taking anything. Let me be very clear about that. What I am telling you is that the system most seniors use to manage their medications has a massive blind spot. And that blind spot is drug-drug interactions. Your cardiologist prescribes for your heart. Your endocrinologist prescribes for your diabetes. Your rheumatologist prescribes for your arthritis. But who is looking at the complete picture? Who is checking what happens when all of those medications land in the same body at the same time? That question is exactly why I made this video. There are 5 specific combinations that I see over and over again in seniors, and the consequences can be devastating. Falls, confusion, memory problems, kidney damage, and in some cases, hospitalization. Let's start with number 5 and work our way up to the most dangerous. Medication combination number 5. Blood thinners combined with over-the-counter pain relievers, specifically NSAIDs like ibuprofen, naproxen, and aspirin. If you're taking a blood thinner like warfarin, also sold as Coumadin, or one of the newer drugs like Eliquis or Xarelto, you already know that these medications make your blood less likely to clot. That's the entire point. They protect you from strokes and blood clots. But here's what most people don't realize. When you add an NSAID on top of that, something you bought at the pharmacy without a prescription, something that seems harmless, you are essentially removing 2 layers of protection from your digestive system at the same time. Blood thinners reduce your blood's ability to clot. NSAIDs damage the protective lining of your stomach. When you combine them, a minor stomach irritation that your body would normally handle on its own can turn into a serious gastrointestinal bleed. And because your blood can't clot properly, that bleed doesn't stop on its own. A study published in the Journal of the American Medical Association found that seniors taking warfarin along with an NSAID had a nearly 4-fold increase in the risk of serious gastrointestinal bleeding compared to those taking warfarin alone. 4 times the risk. And here's what makes this particularly dangerous. Many seniors take ibuprofen for arthritis pain or a headache without ever thinking to mention it to their doctor because it's just an over-the-counter pill. It doesn't require a prescription, so it feels safe. It is not safe in combination with blood thinners. If you need pain relief and you're on a blood thinner, ask your doctor about acetaminophen, Tylenol, which does not carry the same bleeding risk when used as directed. But do not take ibuprofen, naproxen, or aspirin without having that conversation first. Think about that for a moment. Something you can buy at any grocery store could send you to the emergency room if it meets the wrong medication in your bloodstream. Combination number 4. Blood pressure medications combined with over-the-counter decongestants. This one catches people off guard every single winter. You get a cold, your sinuses are congested, you reach for a decongestant like Sudafed, Afrin, or anything containing pseudoephedrine or phenylephrine. Seems completely reasonable. But here's what's happening inside your body. Decongestants work by constricting your blood vessels. That's how they reduce swelling in your nasal passages. But those same blood vessels run through your entire body. When pseudoephedrine constricts the vessels in your nose, it also constricts the vessels everywhere else, including the ones your blood pressure medication is trying to relax. Your blood pressure medication, whether it's a beta blocker like metoprolol, a calcium channel blocker like amlodipine, or an ACE inhibitor like lisinopril, is working to open your blood vessels and reduce the pressure. The decongestant is working to squeeze them shut. These two medications are literally pulling in opposite directions. And when the decongestant wins, your blood pressure can spike to dangerous levels, sometimes higher than it was before you started medication. The American Heart Association has explicitly warned that people with high blood pressure should avoid decongestants containing pseudoephedrine and phenylephrine. A study in the American Journal of Hypertension found that pseudoephedrine raised systolic blood pressure by an average of 9 points in hypertensive patients, and in some cases, the spike was over 20 points. That is not a small number. A 20-point spike in blood pressure can trigger a hypertensive crisis, which can lead to stroke. The safer alternative for congestion is saline nasal spray, a humidifier, or asking your pharmacist for a cold medication specifically labeled safe for high blood pressure. They exist, but you have to ask. Now, before we get to number 3, let me ask you this. Have you ever been told to avoid grapefruit while taking medication? Did your doctor explain why? Or did they just say, don't do it, and move on? Let me give you the real answer. Combination number 3. Cholesterol-lowering statins combined with grapefruit or grapefruit juice. Statins, including atorvastatin, sold as Lipitor, simvastatin, sold as Zocor, and lovastatin, are among the most prescribed medications in the world for seniors. Over 40 million Americans take a statin, and many of them have been told at some point to avoid grapefruit. But most have no idea why, and more importantly, they have no idea how serious the interaction actually is. Here is the mechanism. Your liver uses an enzyme called CYP3A4 to break down statins and clear them from your body. Think of this enzyme as a filtration system. It controls how much of the statin stays in your bloodstream and how much gets removed. Grapefruit contains compounds called furanocoumarins that block this enzyme completely. When CYP3A4 is blocked, your body cannot clear the statin, and the medication builds up in your bloodstream to levels far higher than your doctor intended. Research published in the American Journal of Medicine found that a single glass of grapefruit juice can increase the blood levels of simvastatin by up to 330%. That is not a typo. 330%. You would effectively be taking 3 to 4 times your prescribed dose. And at those levels, the risk of a condition called rhabdomyolysis, where muscle tissue breaks down and floods your kidneys with toxins, increases dramatically. A study in the Canadian Medical Association Journal documented cases where seniors on statins who consumed grapefruit regularly developed severe muscle pain, weakness, and kidney damage that required hospitalization. This is not theoretical. This is happening. The fix is simple. If you're on a statin, particularly simvastatin or atorvastatin, avoid grapefruit entirely. Switch to oranges, lemons, or other citrus fruits that do not contain furanocoumarins. And if you love grapefruit and refuse to give it up, talk to your doctor about switching to a statin that is not affected by grapefruit, such as rosuvastatin or pravastatin. Those two are processed by a different enzyme and do not carry the same risk. If this information is new to you, if you're learning about interactions that your doctor never mentioned, you are not alone. Take a moment right now to like this video and subscribe. I publish weekly content specifically for seniors and caregivers, and the next video could contain the information that changes your next conversation with your doctor. We still have the 2 most dangerous combinations to cover, including number 1, which is something that millions of seniors take every single day, and it is silently destroying their memory. Do not go anywhere. Combination number 2, diabetes medications combined with beta blockers. This combination is dangerous for a reason that most people, and unfortunately, many doctors, do not fully appreciate. It masks the warning signs of low blood sugar, and low blood sugar in a senior can be fatal. Here's how this works. When your blood sugar drops too low, a condition called hypoglycemia, your body has an emergency response system. Your adrenal glands release adrenaline. That adrenaline causes your heart to race, your hands to shake, and you to break into a sweat. These are your body's alarm bells. They are telling you your blood sugar is dangerously low. Eat something now. Beta blockers, medications like metoprolol, atenolol, carvedilol, and propranolol, are prescribed to slow your heart rate and lower blood pressure. That's what they're designed to do. But in doing so, they also block the effects of adrenaline on your heart, which means they silence the alarm. Your blood sugar drops. Your heart should be pounding. Your hands should be shaking. But the beta blocker mutes those signals. You feel fine until you're not. A study published in Diabetes Care found that seniors taking both insulin or sulfonylureas, a class of diabetes medications that includes glipizide and glyburide, along with a beta blocker, experienced severe hypoglycemic episodes at nearly twice the rate of those not on beta blockers. And crucially, they were far less likely to recognize the symptoms before it became an emergency. Severe hypoglycemia in seniors can cause confusion, loss of consciousness, falls, seizures, and in extreme cases, brain damage or death. And the danger increases with age because your body's natural counter-regulatory response, the backup systems that raise blood sugar when it drops, becomes weaker over time. If you are on both a diabetes medication and a beta blocker, here is what you need to do. First, ask your doctor if your diabetes medication dose needs to be adjusted. Second, check your blood sugar more frequently, especially before driving, before bed, and anytime you feel even slightly off. Third, always carry a fast-acting glucose source, glucose tablets, juice boxes, or candy, and do not wait for symptoms to use them. With this combination, you cannot rely on how you feel. You have to rely on the numbers. And now we come to number 1, the combination I warned you about at the start of this video. The one that is silently destroying memory in millions of seniors. If you're taking any of the medications I'm about to name, I need you to listen to every word of this section. Combination number 1, anticholinergic medications, and specifically, the cumulative effect of taking more than one. The term anticholinergic refers to a class of drugs that block a neurotransmitter in your brain called acetylcholine. Acetylcholine is essential for memory, learning, attention, and the smooth functioning of your nervous system. When you block it, you interfere with the very chemistry that keeps your mind sharp. Now here is what makes this so dangerous. Anticholinergics are not one medication. They are an entire category that spans dozens of common drugs, many available over the counter. And most people taking them have no idea they belong to this class. Common anticholinergic medications include diphenhydramine, sold as Benadryl, used for allergies and sleep. Oxybutynin, sold as Ditropan, used for overactive bladder. Tolterodine, sold as Detrol, also for overactive bladder. Amitriptyline, an older antidepressant still prescribed for nerve pain and sleep. Paroxetine, sold as Paxil, an SSRI antidepressant with strong anticholinergic effects, and even some antihistamines like chlorpheniramine, found in many cold medicines. Now, any one of these medications alone carries some risk. But the real danger is what researchers call the total anticholinergic burden, the combined effect of taking 2, 3, or 4 of these drugs at the same time. Because each one blocks acetylcholine a little more. And when you stack them together, the effect on your brain is not additive. It is exponential. And here is the research that should make every senior and every caregiver pay close attention. A landmark study published in JAMA Internal Medicine in 2015 followed over 3,400 seniors for more than a decade. The findings were alarming. Seniors with the highest cumulative anticholinergic exposure had a nearly 54% increased risk of developing dementia compared to those with no exposure. 54%. And the increased risk persisted even years after the medications were stopped. A more recent study in the British Medical Journal in 2019 expanded on these findings, confirming that long-term use of strong anticholinergic medications, defined as just 90 days or more of continuous use, was associated with a significant increase in dementia diagnoses. And the most commonly used strong anticholinergic in that study? Over-the-counter diphenhydramine, Benadryl, the allergy and sleep aid that sits in millions of medicine cabinets right now. If you are over 60 and taking Benadryl for sleep, Ditropan for your bladder, and Paxil for your mood, that is a triple anticholinergic load on your brain every single day. Your memory is being slowly, quietly eroded, and you may be attributing it to normal aging. It is not normal aging. It may be your medications. So what do? You do not stop any medication on your own. That can be dangerous. But you do need to do this. Make a complete list of every medication and over-the-counter product you take, including allergy pills, sleep aids, and cold medicines, and take that list to your doctor. Say these exact words. I am concerned about my total anticholinergic burden. Can we review my medications together and find safer alternatives where possible? Safer alternatives exist. For sleep, melatonin in low doses, or a medication like trazodone that does not carry anticholinergic effects. For allergies, cetirizine, Zyrtec, or loratadine, Claritin, which are second-generation antihistamines with minimal anticholinergic activity. For overactive bladder, mirabegron, Mirbatric, which works through a completely different mechanism. These substitutions can reduce your anticholinergic burden dramatically while still managing your symptoms. Let me give you the 5 combinations one more time so you can write them down or screenshot this section. Number 5, blood thinners plus NSAIDs like ibuprofen, quadruples your risk of gastrointestinal bleeding. Number 4, blood pressure medications plus decongestants like Sudafed can spike your blood pressure by 20 points or more. Number 3, statins plus grapefruit can multiply your statin dose by 3 to 4 times in your bloodstream, risking muscle breakdown and kidney damage. Number 2, diabetes medications plus beta blockers masks the warning signs of low blood sugar, doubling your risk of a severe hypoglycemic episode. And number 1, multiple anticholinergic medications, including Benadryl, Ditropan, and Paxil, increase your risk of dementia by up to 54% when taken together long-term. If even one of these applies to you, you need to have a conversation with your doctor. Today, not next week. Not at your next scheduled appointment. Today. I want to tell you about a woman I'll call Dorothy. Dorothy was 74. She was on a blood thinner for her heart rhythm, Benadryl every night for sleep, and an over-the-counter decongestant she'd been taking for years for chronic sinus pressure. 3 medications. None of her doctors had ever looked at them together. One morning, Dorothy woke up dizzy and confused. She fell in her bathroom. She spent 5 days in the hospital. The fall broke her hip, and she never regained her full independence. Dorothy's story is not rare. It happens every day. And the tragic truth is that most of these medication interactions are preventable, if someone had just looked at the complete picture. That is why I made this video. Not to frighten you, but to give you the information that could prevent the next fall, the next hospital visit, the next irreversible decline. This is not about fear. This is about having the knowledge to protect yourself and the people you love. If this video helped you, please share it with someone you care about right now. A parent, a spouse, a friend who takes multiple medications. It could change the conversation they have at their next doctor's visit. Drop a comment below and tell me which of these 5 combinations surprised you the most. I read every single one. And if you haven't subscribed yet, please do. I'm here every week with honest, practical health guidance for people over 60. Take good care of yourself. You deserve to feel well. I'm Dr. Elizabeth Aliu, and I will see you in the next video. Disclaimer: this video is for educational purposes only and is not medical advice. Always consult your healthcare provider before making any changes to your medication regimen.